Hello, I'm Tom Johnson, the owner and designer of the Mechanical Advantage stretching harnesses. I'd like to show you the last one now, the Dorsi Flexion. That's for the foot and ankle. It looks pretty complicated right now, but it's really very simple. It's in two pieces. I'm going to separate the two pieces. There's two big buckles right here. I'm going to separate the pulley system from what I probably call, it's almost like a stadium chair. A stadium seat where it goes around behind my lower back and gives you some back support when you sit down. All you have to do with this is a red belt. This is actually the waist belt to hold it in place around your waist. There's a little different buckle on it. You can squeeze both sides, it opens up. Okay, we're going to buckle this around my waist. Pull on the straps a little bit. You see how that's going to pull right on my lower back right here? Okay, I had all the physical therapists. I used to go into the clinic selling my knee harnesses, and I'd see the Achilles patients up on a treatment table pulling on a towel to try to get that dorsiflexion back in their foot, right? This is dorsiflexion for you patients, right? Dorsiflexion, plantar is pointing. This is dorsiflexion to pull back. Pulling on a towel, and the therapist would say, yeah, and it's bad for their back because they're pulling, and it's not a good position for the lower back. That's what gave me the idea when I created the pulley system, which they needed. They had Achilles tendons like a steel cable. They needed a lot of power, a lot of force, but again, anchoring it to the lower back, so at the same time, it's giving you back support. So that was the idea behind this back sling belt. Now here's the pulley system again. Just like with the other harnesses, it's the same pulleys. As you pull the handles, this thing shortens. I'll show you right now. I'll get hooked up here. Velcro strap, similar to the prone flexion I just showed you to put your foot in. The proper placement of this dorsiflex of the foot cuff, though, this is pretty crucial to have this in the right spot on the foot. Again, use your shoe. I want to have this shoe for grip, so this doesn't slip off your foot with your sole. But the physical therapist wants you to have this on the wide point of the ball of your foot. So the widest point of your shoe, the wide point right there. If you have it too high, it's just going to bend the toes. And if you have it in the middle of your foot, it's not doing anything. So you want to get it properly placed right there at about the wide point of your foot, and then just adjust the Velcro strap like that. Okay. Now we're going to connect the pulley system to the back sling belt. Okay. See these two big buckles on each side? You're just going to snap in the left side like that. Pretty simple. Find my other belt here. There we go. And this is on the outside, by the way, because you're going to have to pull on this next. You can't have it like that on the inside. You want to, again, there's no twist in the belt. See it? That puts these on the outside. So because you're going to grab these next, you want to take all this slack out of the pulley system by pulling on the handles. And you're going to feel it start to actually stretch your foot, your Achilles right there. Because as you tighten up these belts, it's going to start to hurt a little bit. Tighten it up until it does start to, you feel a little bit of pain from the stretch right there. Now you're ready to use the actual pulley system, okay? Now I put cord locks on each handle here. See these little cord locks? I usually open them up so I can get my hand around there. Just get them in front of my knuckles. I'll open this up a little bit more like that, okay? Now I'm going to pull on the pulley system until it starts to hurt a little bit more, like that, to stretch. Now here's the important part. Put both handles in one hand like that. This frees up my hand. I'm going to take the cord lock and push it all the way forward, okay, and that clip, and now I'm hands-free, okay? That's going to hold it there, okay? The one thing you do have to do with this is you have to maintain your knee pretty straight. You don't want to lock your knee out and put any stress on the knee, but you're going to have to keep your knee bent just a little bit to maintain that. Sometimes in the clinics they'll put a roll under your knee, just to give you a little bit of bend in the knee, and you want to keep your knee in contact with that roll on the physical therapy table. But at home, I mean, you can feel there's a little difference too when you straighten your knee out. It helps you stretch a little bit more, but you're going to have to maintain that at home, the angle of your knee right there. And then again, after the pain diminishes, like all the other harnesses I just showed you, you're going to pull a little bit more until it starts. Ooh, I forgot how tight my calf was. Ooh. pull till it hurts a little bit more. I'm feeling it in my calf right now. And then you go like this, put those cord locks all the way forward. And again, you can let go. And again, this is doing a lot of work for you. Oh, the reason why there's two handles on the Dorsi Flexion is years ago I had one handle on the first one. A physical therapist wanted you to, let me show you how this works. It's called inversion, eversion. They want you not only to dorsiflex, to stretch into this Dorsi Flexion, they wanted you to be able to twist. Inversions to the inside like this, and they would lock you out like that. Or eversion, they wanted some twist to the outside. Okay? So they wanted to do both. They wanted to stretch you into Dorsi Flexion with some eversion or some inversion. Okay? So that's why I kept the handle separate, but for most folks, you're just going to pull it straight back and lock it out just into straight Dorsi Flexion like that. Now recently I've had a lot of calls for this, not just for Achilles, for the ankle, or for an ankle injury, but for a plantar fasciitis. A lot of my friends my age here in their 60s now are having a lot of trouble with that, and they're getting a great relief from this at home, stretching once or twice a day for that condition. Again, when you're all done, oh, here's another thing I want to show you. If you don't get these buckles really, really tight as you're stretching, you might get to a point where you can't pull back any farther. All right, and you want to. Don't start grabbing the lines and just start reeling this thing in. What I want you to do is come back to the start position again, okay? Because you get back here, you can't pull any farther. Get back to the start position with the handles. Pull on the belt buckles again. Once you tighten up the belts again, now you're going to be working in this range again, not way, way back here, okay? That's important. Okay, so now you're back in here again and using your cord locks, okay? So that'll take care of my demonstration for the Dorsi Flexion Harness. Let's see, when you get all done, you can just pop the buckles to get out like this. And this harness never really tangles either. You can see if you have the buckle upside down, you see the twist? It's pretty simple to see that those lines are just all parallel. You have these upside down. The handles are always on top, so you can see the handle has to be on top. There's no twist in the lines. You see that red thread? I almost forgot to show you. That shows you that is in the up position. I wouldn't put it on my foot upside down like this. That would be wrong, because then the handles are underneath you. See, the handles would be on the bottom underneath. Yeah, we don't want that. Okay, so that's what the red thread's for. And again, after you get this adjusted to your foot, see how you just slide it back in place every time you go to use it. Okay, make sure there's no twist. You got the handles are on top, and you just buckle in again, and away you go. Okay, thanks again for your time. And my website is www.mechanicaladvantage.us. Thank you for your time.